Some of the most vulnerable people in this country who have signed up to receive the vaccine are being turned away when they get to the vaccination site because they don't have the proper identification. This includes undocumented immigrants, people experiencing homelessness, and older adults who can't drive. States across the country implemented strict ID requirements in an effort to combat vaccine tourism and to ensure doses get to people who are eligible. But as it turns out, not everyone who is eligible has the right papers. For more on this, I want to bring in Clavin. She is the co-founder and CEO of the Project ID Action Fund and founder and executive director of Spread the Vote. Kat, thanks for being here with us. Remind us why it is so important to get as many people, particularly from vulnerable communities, vaccinated as soon as possible.
Hi, well, thanks for having me. And, we're in a global health crisis. And the last thing that we want right now is to tell people who are the most vulnerable and who, in many cases, are the most likely to contract COVID that they can't get vaccinated. Coronavirus disease, it doesn't care if you are unhoused or if you live in a gated community. It's coming for all of us. And the only way that we can resolve this crisis is by making sure that everybody gets the health care they need, that everybody gets vaccines. And that means making sure that there is equity in the vaccine distribution and that people without IDs are sure to get it.
And Kat, at least 11% of American adults, or 21 million people, do not have a government-issued photo ID, according to the Brennan Center for Justice. The Brookings Institute estimates that there are as many as 12 million undocumented immigrants in the United States. I want to ask two questions on this. First of all, why is obtaining proper identification such a challenge in this country? And second of all, are you seeing that people are not even signing up because they're concerned that they don't have the right documentation to get the vaccine?
Well, to answer your first question, anyone who's ever been to the DMV knows that it's not easy to get an ID. You need a lot of different documents, right? Birth certificates and proofs of residency and proofs of identity. You need money. Our average ID cost is $40, which is quite a lot when you don't have a job, which you can't get without an ID. It can range even higher than that. Say, for instance, if you need a birth certificate, which 57% of our clients do, that can range anywhere from $10 to sometimes $90, depending on the state we have to get it from. So you're looking at, needing to gather quite a few documents, usually 6 or 7 pieces of documentation at least. You need to get to a DMV. More than 10 million Americans live more than 10 miles from a DMV. So transportation is really difficult. You need money. On average, it takes us 3 to 4 weeks to get someone an ID. And that was pre-COVID. Now, with DMVs being closed with limited appointments, it's taking months often to get IDs. And so it's a real challenge. And then to answer your second question, which, I'm so sorry, I forgot because I was answering the first one.
No, I was also asking about ID requirements in terms of depressing the number of people who sign up for vaccinations for fear that they don't actually have the right documentation.
Yeah, this is a problem that we see a lot. We help people get IDs all over the country. And very frequently, we will have clients who say that they didn't try to get, X thing or go to X place to get, the healthcare they needed or this or that because they thought they'd ask for an ID. And the same thing is true with vaccinations. One of the things that we've been seeing particularly is that people who are undocumented are afraid of going to get a vaccine because there have actually been cases when people have asked about citizenship status or they're afraid that they will. And we haven't made it clear enough that we don't care about your citizenship. We don't care about what your documentation is. That the thing that matters is getting you this vaccine so that we can stop this crisis. And so we are certainly seeing people who aren't going because they're afraid or because they're hearing horror stories from people who've been rejected. And they're just deciding, this isn't something that I even want to try. I don't know what the consequences are going to be.
So, Kat, we heard early on in the pandemic reports of people who were not eligible to get these highly coveted vaccines, who were trying to show up either from out of state, out of country. They didn't meet the requirements for age or other vulnerabilities, and they were trying to get the vaccine and hop in place in line. Is there a value at all to having ID requirements?
Here's the thing, and this is where we need really thoughtful and sensitive public health policy. I understand why IDs are required. We've had people coming from all over the world. We've had all sorts of, people trying to cheat and get in line. But we also have 21 million American adults who don't have the ID that they need. And so what we really need to be thinking about is, what can we do besides requiring photo ID? There are places that have been more expansive in the types of documentation to allow, they'll allow utility bills or rent, leases, things like that, which is not foolproof because we have, most of our clients who we work with don't even have those things. We really need to start thinking outside of the box and thinking about, if we're looking at the communities that need this the most, if we're looking at the percentages of people who are unhoused, who don't have identification, what are ways that we can make sure that they're getting their vaccinations, but also that we're not allowing vaccine tourism? It's not an easy fix. It's a reason why we just need to make sure everyone has an ID in the first place, right? This is why we have an ID crisis. Is when people don't have ID, then when we have an emergency, all of a sudden we don't have solutions because we haven't made sure that people have the thing they need in the first place. So we need to be creative, we need to be sensitive, and we really have to think outside of the box to solve this.
Kat, we only have time for one more question, though this area is so rich for discussion. Really quickly, somebody who doesn't have proper identification but wants to be vaccinated against COVID-19 and meets the requirements, what do you say that they should do?
First of all, it's worth trying, right? The vaccine, it's so important. We all need to get it. We need to end this pandemic. The biggest thing that we can say is call ahead. A lot of national drugstore chains have made a commitment to not require ID. And there are so many different sources of vaccinations. There are cities, there are counties, there are private drugstores, there are all these things. So call ahead. If you don't have access to a phone, which I know a lot of people don't, then go ahead of time. I know it's tough standing in line, or have a friend or family member call, but really, ask questions. If you have access to the internet, most places show online what documentation they do and don't require, so you can be prepared. There's actually no national database on who does and doesn't require ID for vaccines, so it's something we're putting together right now. But it may take a little more research. It's definitely not fair and it's not right, but it's worth doing it to be sure that you get vaccinated.
All right, Clavin, thank you.
Thank you.